The cardiovascular system. The heart is merely a pump that circulates blood. Blood is transported to the body via arteries and returns via veins. It is a four-chambered muscle that has two sides that do not communicate, oxygenated and unoxygenated blood. Chambers of the heart. You have the right chambers, which is the right atrium, underneath that the right ventricle. The left chambers are the left atrium, and under that the left ventricle. The coronary blood supply is different. It is supplied on the outside via the right coronary artery, the left coronary artery, the left anterior descending, and the circumflex. The conduction system is a specialized tissue that allows rapid transmission of electrical impulses to the myocardium, the sinoatrial node, pacemaker of the heart. Normal rhythmic self-excitatory impulse is generated. This is a picture of the blue. In this depiction they are blue, but these are the nerve fibers that stimulate the heart to beat. The autonomic nervous system control, or when you think of autonomic, think of automatic. Cardiac muscle, you have the sympathetic and the parasympathetic systemic blood vessels. Sympathetic vasoconstriction and parasympathetic is vasodilation. So for our cardiac assessment, the things that you're going to be looking for when you're talking to your patient is PQRST. P, provocative or palliative, what makes it worse or better. Quality, describe the symptoms. R, region or radiation, where in the body does the symptom occur. Radiation or extension of the symptoms to other areas of the body. S for severity on a scale from 1 to 10, 10 being the worst. How bad is the symptoms? And timing. Does it occur in association with something else such as eating? So a system assessment to evaluate the patient's history. We talk about pain, shortness of breath, cyanosis, fatigue, palpitations, syncope, hemoptysis, edema, and the condition of the extremities. You need to evaluate through inspection and palpation and auscultation the neck veins, the central and peripheral pulses, lung sounds, murmurs, pericardial friction rub. The diagnostic tests and procedures, laboratory tests, you have the cardiac enzymes, CABG, LDH, troponin, myoglobin, BNP, CBC, blood coagulation factors, serum lipids, electrolytes, calcium, phosphorus, magnesium, BUN, blood glucose. Myocardial infarction. Main cause is coronary artery disease, narrowing or obstruction of one or more of the arteries. In the bottom you can see the narrowing and the obstruction. Causes of CAD. Non-modifiable risk factors include age, gender, family history, and ethnic background. Modifiable risk factors: smoking, obesity, stress, elevated cholesterol, diabetes, and hypertension. Angina Pectoris, chest pain caused by restricted blood flow. When there's three types. There's stable angina, predictable, increases with exercise. When you stop, it goes away. Unstable angina, unpredictable, increases in severity at times when you are not exercising or exerting yourself. Prinzmetal's angina, caused by arterial spasm. Chest pain unrelieved by nitrogen, elevated ST elevation, inverted T wave on your EKG, elevated troponin levels, elevated CKMB often indicates an MI. Chest pain is often crushing substernal chest pain radiating to the jaw or arm. Pain in women and diabetics may be different or even absent. Treatment. Think of MONA, morphine, oxygen 2 to 4 liters, nasal cannula, nitrogen, aspirin, 12-lead EKG, vital signs, laboratory tests, and monitor for dysrhythmias or heart failure. Heart failure is the inability of the heart to maintain adequate circulation to meet the metabolic needs of the body. Congestion of the lungs in left-sided heart failure, and congestion of the systemic circulation in right-sided heart failure. Many causes: MI, valve problems, hypertension. It's classified as either acute or chronic. For this, you would need to also teach a low-salt diet. Congestive heart failure, for collaborative management, consider oxygen. Always have the head of the bed elevated to help the patient breathe. Vasodilators to decrease the work of the heart, having to pump the blood. and medications to increase contraction, like beta blockers, digoxin, or ACE inhibitors. Diuretics decrease the circulating fluid, thereby making the heart beat the fluid that's in there a little bit easier around the body. Myocardial infarction. This is a heart muscle with damaged heart muscle with muscle damage and a blocked artery. You can see that's on the outside, which is the coronary arteries. So this patient probably is having pain since it's necrotic all the way past that spot. This shows a 12-lead EKG, which the top is the normal one. The bottom is the ischemia. The third one is the injury. The fourth is the acute infarct, and the last is the old infarct. You can see the T waves larger on the ischemia. Injury is even larger. Old is a inverted T. The acute is the inverted T, and the old is just a small t. So what do you do with the heart attacks? Well, you have some reperfusion strategies using thrombolytics, percutaneous transluminal coronary angioplasty, PCTA, or a stent procedure. Post-cardiac catheterization, PCTA care. Monitor vital signs, assess for distal pulses, may use ultrasound because they had a catheter stuck in their femoral artery. Bed rest with limbs straight for 6 to 8 hours. Pressure on site, either manual pressure or there are some mechanical devices. Anticoagulants, antiplatelet agents to prevent any further clotting of the site. Monitor IV nitroglycerin, prevent coronary artery vasospasms, and aspirin once a day permanently. Coronary artery bypass graft, CABG. Surgery if more than 50% occlusion in left main. Left main supplies 2/3 of the heart. Monitor for signs of a decreased cardiac output. Monitor respiratory status. Monitor the wound, which is the sternal site. Dysrhythmias. Try to get the patient up and moving as soon as possible, and consider pain control as one of your top priorities. Asystole and PEA, we'll go over some rhythms now. When a patient is in this, you need to consider the 6 H's and 5 T's below. So you're considering how to reverse this situation using or fixing the problems they currently have. Hypovolemia, hypoxia, hydrogen ion, which is acidosis, hyperkalemia, hypoglycemia, or hypothermia. The 5 T's are toxins, which is do they having a toxic effect from an overdose, tamponade, tension, pneumothorax, thrombosis, or trauma. Cardiac pacemakers. Let's talk about devices that provide electrical stimulation and maintain the heart rate. You can see a small line right here. That is the electrical signal that's being put out in order for the heart to beat. Pacemaker education. You need to know when to notify the MD. Dizziness, weakness, sudden weight gain 3 to 5 pounds. Overnight, sudden changes in pulse. The weight gain is caused by fluids that are not being pumped around the body and they are just collecting. Signs and symptoms to report. Redness, swelling, drainage from insertion site, dizziness, fatigue, shortness of breath, chest pain, or swelling of the ankles or legs. Heart valves. What we have here is basically the way the heart valve works. It opens up, lets the blood flow, and the back pressure closes the heart valves. So the red area on this diagram shows the fast-moving blood. There are 4 valves: pulmonary valve, tricuspid valve, aortic valve, mitral valve. Cardiac valve disorders causes symptoms similar to heart failure. Regurgitation is when the valve does not close, causing blood to flow backwards. Stenosis valve is narrow or fused and does not open or close completely, both of which cause problems. If you will notice this illustration, if this didn't close completely, blood would rush back in here. If it didn't open all the way, blood would have a hard time going through here, both of which would cause congestive heart failure-like symptoms. Pericarditis is inflammation of the pericardium, which is the sac that surrounds the heart, and if that gets inflamed, it causes friction and pain. Multiple causes, which could be post-MI if you have damaged tissue, post-cardiac surgery, infections, tumors, connective tissue diseases, or endocrine problems. Symptoms: chest pain made worse by breathing, friction rub, or elevated ST segments. Pericarditis treatment: rest, NSAIDs, and possible corticosteroids. Endocarditis: an infection or subsequent inflammation of inner layer of heart, usually involves the valves, can cause fever, chills, white blood cell count elevation. They will have positive blood cultures. You diagnose with an echocardiogram. Therapeutic management: IV antibiotics for 6 weeks to treat that infection, teach prevention, and consider inpatient treatment if patient is an IV drug abuser. Hypertension, high blood pressure. Diagnosis is systolic blood pressure greater than 140 millimeters of mercury or diastolic greater than 90 millimeters of mercury on 3 separate occasions. It's usually asymptomatic, so that's why they call it the silent killer. You don't feel any different, you don't know you have high blood pressure unless you get it checked. Some report a headache, especially in the early morning, but for the most part, it is asymptomatic. Risk factors include family history, age, race, obesity, heavy alcohol, and high sodium intake. Therapeutic management of hypertension: step therapy. Start with lifestyle, stress, weight, diet changes, then medications, diuretics, beta blockers, ACE inhibitors, angiotensin receptor blocker, calcium channel blockers, and alpha blockers, all different kinds of antihypertensives. Hypertensive crisis is when a systolic pressure greater than 180 millimeters of mercury and diastolic pressure greater than 120 millimeters of mercury cannot reduce pressure too fast or risk cardiac ischemia. So the heart kind of gets used to this high pressure. If you take it down too fast, you won't be able to perfuse the heart. Peripheral vascular disease, what is it? It's disease that reduces the peripheral blood flow, usually caused by atherosclerosis, which is plaque development, but can be caused by trauma, embolism, thrombosis, or vasospasm. Peripheral vascular disease assessment and treatment. You'll have cool extremities because the blood's not getting there. Diminished pulses because the blood is not getting to the lower parts, extremities. Thick nails, shiny skin, or hairless lower extremities, also present in advanced cases. To avoid problems, don't cross the legs. That puts pressure, undue pressure on the lower extremities. Avoid smoking. That reduces blood flow. Wear compression stockings to keep the blood moving back to the heart. And exercise as much as possible. And in severe cases, consider surgery. Aortic aneurysm is a localized weak or dilation of the wall of the aorta caused by congenital weakness, trauma, disease, atherosclerosis. It's noted by a pulsating abdomen or chest, a systolic bruit, and many times it's not symptomatic until rupture. Rupture may present as a sudden tearing pain in chest. Diagnosed by imaging, MRI, CT, echocardiogram. Here's a picture of the thoracic aortic aneurysm. It's a huge pouch, and the bottom right, which is C, abdominal aortic aneurysm. Thank you, and that's all for this session.